Hi,
Hi,
Miss.
hi, good afternoon.
Good afternoon, Miss.
Okay, let's wait for your friends.
Okay.
How is everything there, Belen?
Everything is fine, Miss.
When are you gonna start your classes again?
No, I don't have classes.
What did you tell me last class? You were doing a rotation or something like that?
Yes, my practices
Okay. So when are you gonna start those?
on Monday.
Oh, oh, hi, Ale. How are you?
Hi, Miss. Hi, Belen.
Hi,
How are
Ali.
you? I'm fine.
Oh, I'm pretty fine, thank you. Okay. I think we can start now. Okay. Today we're gonna talk about some things that you already know. We're just make a review, okay? And I wanna know your positions. If you do something else different than the things I'm presenting to you, I want to share with us, okay? We're going to talk about explaining diagnosis and management. Okay, so explanations is the final part of a consultation, which should cover first diagnosis. Who is it? Okay, Lily, how are you?
Good afternoon, teacher.
Good afternoon.
Hi, girls.
Okay, so I was saying that today we're going to start talking about explaining diagnosis and management, okay? Then we have the explanations. That is the final part of a consultation, which should cover first, a diagnosis. That is an identification of the disease from its signs and symptoms, okay? You may say to the patient, you're suffering from, and you have to explain what the patient has. You've developed or you have this kind of disease, or this is mainly because your alimentation, your habits, and try to explain to them. Or this is why you have to change your diet maybe, and try to say your patients what they're gonna do. I don't know what kind of things or of phrases or maybe suggestions you use to explain to your patients. Maybe some others than the ones I'm presenting to you. Or you are agree with those?
I'm agree, Miss.
Okay.
I think these expressions are most common in the consultation.
Okay, Lily and Belen, thank you. Yeah, those are the most common ones. But maybe you have another way to say it. And I am curious about that. I want to know. Okay, and if you have that another way, okay, you can share with us. Okay, Belen, can you read this part for us, please?
Okay, sorry. The management plan, including investigations and treatment. I will make you an appointment with, I'm going to start you on medication too. I'm going to have you admitted to. I will arrange for you. You will be given. I expect you will have. They may advise. They may advise.
Okay, thank you, Ellen. And yes, we have this part, that is the second one. The first one was the diagnosis. The second one is the management plan. Okay, so you have those phrases to start a suggestion. And maybe you have some questions about vocabulary. Of course, most of them are almost the same, right? For example, I'll make you an appointment with, okay? It means that I'm not an specialist, but I will send to the specialist and I will help you making an appointment with him, okay? It's almost the same as I'll arrange for you. Do you understand that expression?
No, miss. What does appointment mean?
Appointment, it's a kind of date you have with your doctors, okay? It's part of a schedule. For example, I will call today and I want an appointment for Alejandra, for Dr. Alejandra, for tomorrow. And the assistant will make an appointment for me with you. Do you understand now?
Yes, miss.
Okay. Another question.
Teacher, the expressions I'll arrange for you, this have the same meanings? Or I'll make you an appointment with, or no?
I'm sorry. The sound behind is very loud. Okay. It's an expression that means almost the same. Okay. I'll make you an appointment with is that someone is helping you to get an appointment with other person and he will do it for you. I'll arrange for you is almost the same. In Spanish is, for example, lo voy a arreglar por vos, o voy a arreglar que tengas esa cita. Okay, so it's almost the same. It helps with the appointment, okay?
Okay, teacher, thanks.
No problem. I don't know if you have any other questions.
No, miss.
Okay. Then, Lily, can you read this part, please?
Okay. General advice about change in lifestyle that may be needed. The Nurse Guild gives advice on you should try to give up. I want you to. It's important that you.
Okay, thank you very much. That's a general advice about change in lifestyle that may be needed. Well, not only the nurses will give an advice on something, okay? Of course, doctors have to do it. And you can use those phrases to start. You should try to give up cigarettes or alcohol or anything you think it's not good for the patient, okay? Or I want you to take maybe those pills with only water. I don't know, I'm just saying, okay? But you can make some advices. And it's important that you can take those pills on the at 3 p.m., I don't know, 11 p.m. and 6 a.m. Okay? So I don't know if you have any other way to give an advice for your patients. Or if you want to add something else, because those are only examples. Someone? I don't think those are the only phrases we can use.
Maybe you can explain about the food that he can eat or not, because that's important about changing lifestyle,
Mhm.
to do exercise and those kind of things. I don't know.
Yeah, that's good. It's okay. Because you're not only will say, okay, I want you to do this, but why? You have to explain to your patient the importance of changing habits is, okay? That's a good point, Belen. You don't have to say, just take those pills, okay, bye, right? You have to explain your patient. You have to tell him that what things are good for him or her, and why is he or she taking those pills. Okay, another thing you want to add here, but we are good.
It's fine, teacher.
Okay, Ale, what about you?
It's fine, Miss.
Okay, let's continue then. Then we have the prognosis. Ale, can you read this part, please?
Yes, Miss. The prognosis. What is likely to happen because of disease? Stressing that nothing is certain. I expect the treatment will. Hopefully we can. We can never be absolutely certain about. You should remain optimistic. Optimistic?
Optimistic. Okay, that's so good. Um, do you know this word prognosis? Do you understand?
Yes, Miss.
Okay. What about Belen and Lily?
Yes, Miss.
Yes, teacher.
Okay, that's so good. I want to know, what do you think about the prognosis? It's it's a very difficult part to say the prognosis, or you have a manage, so I don't know, you can manage so good this part. What happened with the patient, with future, and with the family of the patient? Do you think it's something that you can manage easy or not so easy?
Well, it's not too easy because we cannot promise things that we can do. And also that giving high expectations to our patients is bad too, even if they're getting better. So I think that we have to be realistic, but very careful with our words because we cannot be. We have to be really empathic, and that.
Okay, Belen, I agree with you. What about Lily? What do you think, Lily?
For me, the prognosis it's very hard, but I think the saint of Valent, we have to talk the patient with reality without to believe false expectations in the patient.
Okay, Lily, that's a good point. That's true. And I want to know, of course, Alice's answer. What do you think, Ali?
I am agree with my partners, but it depends of the disease because there are other diseases that have better evolution.
Okay, that's true. Yeah, we have to be very careful with our words, as Belen says, right? Because we cannot be certain of the progress and evolution of the patient. That's why we have these examples. I expect the treatment will, and you will explain what will the treatment do, okay, or does. But you will say that you're expecting, you have to tell your patient that you're not sure, but not with that words. No, I'm not sure about what we are doing. We don't know. Not like that, of course. But you have to tell them that it should work, but we have to see in the future. Like that, right? Hopefully we can. Okay, it's another expression that we can use, and we can never be absolutely certain about, right? And you should remain optimistic. I think an important part of giving support to our patients is making feel that there is hope, right? I don't know what you think about that. Are you agree with me? You don't?
Agreements.
Yes,
Oh.
Richard, I agree with you.
Yes, miss, I agree, and we have to make the patients feel that we are with them
Yeah,
in all
that's so
the
good.
process.
Yeah, Alan, that's so good. Yeah, because I think the patient comes to us to our consultation because they think we have the key, right? We have the answers. We can make something. Uh, as I saw in all these years, a doctor, uh, whichever with specialization or not, a doctor seems to be almost God for the patient. So we have to um, act at that level, not that level as God, of course, but we have to be support and take care of our patients, and not only maybe because we are busy or something, talk to them like, yeah, I know, okay, take this and let it go, bye, right? We have to be respectful and take care of them. And I feel so happy that you think the same. I know you are a good professional, and of course Ale and Belen will gonna be a good professionals too. Okay, let's continue then. Well, we have the question time, where the patient can ask questions about his or her illness. And the doctor may say, do you have any questions? Or is there anything you'd like to ask? And and of course the patient will have a lot of questions, or a list of questions maybe. I don't know if you have any experience that you can share with us about this. Maybe a patient who asked something so strange or a little bit weird. Yes, no.
I
Or
never shared something weird, but
okay.
I think that all the things that we ask is good, because if we have the doubt, it's our responsibility to explain our patients what is happening with them or that things.
Okay, that's so true. What about you, Lily? You don't have that experience?
Yes, teacher. When I finish the consultations, I always ask the patient if they have anything questions. I tried explaining the better way possible.
Yeah, okay. That's so true. Maybe sometime a patient asked me, thinking, of course, I'm a personal of health, right? But I don't know some things like, for example, some pills for abortion, and I was like, oh my God, I don't know about the things. And even if I knew it, I won't give you a recipe or something. So that's my experience, right? I don't know if you have that kind of experience. That's why I was asking to you. What about you, Ale?
Yes, Miss. Once there was a patient who took ovulos for the mouth.
Okay, ovules.
Ovules. Well, she take that by oral way.
Oh my God, poor patient. That's why we have to be very careful explaining to our patient if they understood the explanation, right?
Yes, it's very important because it could happen things like that.
Yeah, I never heard about that, but yeah, it was so So surprising. Okay, hey Vanya, how are you?
Hello, Miss. Good
Hello.
afternoon.
Good afternoon. Okay, we're talking about explanations of how we explain to our patients, okay? And we are in the question time when the patient try to ask as much as possible, if of course they have doubts. But I was asking if you have any kind of experience with some uncomfortable questions or something, some experience that you remember with your patients. I don't know if you have something to share with us.
Give information is very important for the patients and medical too, and it's the most important. For us it's very important the patient understand this their pathology, their disease, and understand the treatment, who how they should take the pills or treatment. Um, uh, yes, in the there are some questions uncomfortable for the patients when I question about the enolic habits, enolics. Or
Okay, what is an enolic habit? I'm so sorry.
enolic habits, if they, well, if they are person drinking, usually drinking, I don't know.
Oh, okay. Okay, I understand now.
Or usually for drugs is they lying about this.
Okay, yeah, I agree with you. It's important not only for the patient to know and understand, but also for the doctor, because what happened is maybe the patient understood so bad and took another pill or make things different. Maybe it can be a problem for the doctor after that, after all that were right. So we have to be really careful about that. Thank you for sharing with us your experiences. Okay, Vanya, can you read this part, please?
Using lay terms in explanations. Explanation should be given in words the patient will understand, avoiding medical jargon or jargon, using light terms, words familiar to people without medical knowledge can help patients understand explanations. For list of some common light terms for conditions, parts of the body and the medication, etc.
Okay, thank you, Vanya. Yes, we have to use lay terms in explanation. Do you understand the expression lay terms?
No, teacher, I don't understand this
Okay.
this word.
Okay. We talk about lay terms when we uh, speak to the patient in words the patient will understand. Okay, avoiding medical jargon. Jargon is jerga médica. Okay, So we have to use easy words to explain to our patient because they won't understand us if we talk about with medical jargon. That's why we call lay terms, okay? Of course, those are words familiar to people without medical knowledge and can help patients understand explanations, okay? I don't know if you have any example for lay terms.
For example, when we using Disney, the patient don't understand. They generally using falta de aire. Bueno,
Okay, loss of air. Okay, that's a good example, Lily. But you have to tell me in English. Don't forget about that. Okay, another example.
I don't know if we're doing an appendicectomy, like saying the patient, oh, we're gonna do the incision on the McBurney point or something like that, and he's not going to understand us. So we have to be careful and say like, okay, we're gonna cut here and you're gonna have like, I don't know, if they're gonna use laparoscopy, you're gonna have like some points and that things.
Yeah, that's a good example, Belen. Okay, Ale, what about you and Vanya? Do you have any other examples?
When we ask about the polypsia, we ask about the frequency of drink water.
Mm-hmm.
Yes.
Yeah, that's a good example. And Ale, I know you have an example in your mind. Tell us, please.
That means right now I don't have an example.
How
But
come,
we
Ale?
have to use common words for the patient.
Yeah, that's so true. Okay. Okay, I know you understand this expression now. And we have an example here. Belen, you will read the first paragraph. Lily, you will read the second paragraph. And Ale, you will read the third paragraph, okay?
Okay. An explanation of angina. How can I say it, Miss?
Angina.
Angina. Okay. Having examined you, I'm confident that you are suffering from angina. The heart is a pump. The more you do physically, the harder it has to work. But as we get older, the blood vessels which supply oxygen to the heart begin to harden and get furred up, so they become narrower. They can't supply all the oxygen the heart needs. The result is the pain you feel as angina.
because you're experiencing pain arrests as well as on exertions. I'm going to have you admitted to the coronary care unit right away so that your treatment can start that once. You'll be given drugs to ease the pain, and I expect you'll have an angiogram. They made advanced surgery or angioplasty. That's a way of opening up the blood vessels to the heart so they can provide more oxygen.
You should try to give up smoking. You won't be able to smoke at all in hospital, so it's a good time to stop. I expect the treatment will improve your pain at least and may get rid of it completely. We can never be absolutely certain about the future, but you should remain optimistic. Do you have any question?
Okay, thank you very much. As you can see, we have here an example of an explanation, a correct explanation, right? And of course, the doctor tried to explain in lay words. Okay, I don't know if you have any questions here of vocabulary, of course.
What's the meaning of vessels?
Vessels, blood vessels.
Yes.
Okay, vasos sanguíneos. Did you hear, Vania?
Yes, Miss.
Okay. Another question here.
Teacher, in the last paragraph, what means get rid of, of it? In the first line?
Oh, in the last paragraph.
Sí, yes.
Oh, okay. Okay. I expect the treatment will improve your pain at least and may get rid of it completely. Okay. Get rid, it's like to end something or to finish. Okay. In this case, it will be like que desaparezca completamente. Talking about pain. Okay. Get rid of something.
Okay, teacher.
Okay.
Thanks. I understand.
Perfect. No worry. Yeah.
What does fuzzed up mean?
Pured up.
In the first paragraph.
Oh, yeah. Okay. The blood vessels which supply oxygen to the heart begin to harden and get furred up. Okay, when we are talking about begin to harden, we think about something that it's make it harder, right? And get furred up, it's like somehow they are mixing one to each other, like enredarse. Okay?
Thanks, Miss.
Okay, perfect. Another expression or word? For example, exertion. Do you understand this word?
Yes, teacher.
Lily, can you explain to us or describe?
Exertion, it's like effort.
Okay.
It's the same.
Okay, that's good. Thank you. I don't know if you have any other doubts here.
No, miss.
No, teacher.
No, miss.
Okay. What about you, Vania? Are you okay with this?
It's okay, Miss.
Perfect. Let's continue then. And we have the discussing treatment. Vania, can you read this for us, please?
Discussing treatment, offering options. There are a couple of options we can use. First option is to try tablets like Prozac that lift you up a bit. The other option is a counseling. It can be caused by diet or stress. There are some quite simple tests we can do. If you're still concerned, we can refer to you a hospital.
Okay, thank you, Vania. Yeah, here we have an examples, right? We can make this or maybe take the other option that is counseling. I don't know if you have questions here. Do you understand the word counseling?
It's like a therapy, right?
Yeah, that's right. The correct word in Spanish, can you tell me, Belen? The translation?
I don't know how to say it in Spanish, but I understand it in English.
Okay, that's so good. But it's asesoramiento.
That-
Okay, but it's it's what you said. Another word.
Teacher, I don't understand the sentence in the first paragraph. In the second line, what says that lift you up a bit? I don't understand what it means.
Okay. It's almost like, let me check. Yeah. It's when you are maybe in a bad mood with depression or something like that. I don't know if we can use Prozac to lift someone up, to make feel better about their mood. It can be.
Yes, but it's not immediately. Immediately. Immediately, it has to be taken like for 2-3 weeks, and there you're gonna feel better.
Okay, but I will use this this example. Thank you, Belen. Okay, Lily. For example, with depression, and you're gonna prescribe to me Prozac, okay? And as Belen says, I will be better in a good mood without depression, maybe, okay? And I will say that the Prozac lift me up, like levantarme. Do you understand?
Yes, teacher.
Do you have any example for a discussing treatment?
I believe when we using, for example, dipirona when the patient have a fever, then if we treat this sign, the patient improved very fast. Date referred, I felt better or not.
Okay. Okay, Lily, that's so good. Dipirona, then. Okay, thank you. I don't know if you have any other questions here. Or maybe something you want to add.
No, miss.
Miss.
No, miss.
Okay,
No, teacher.
perfect. Then we have advising a course of action. When advising course of action, doctors may say, we can find some examples. Some time of work might help. If you felt that would be helpful, you could take a week and see how you felt after that. Okay? Carry on lots of fluids. Or if you still have some pain, you can keep taking paracetamol. Or other thing might help, like raising the head of your bed. That's one of the simple things we could start you off with. You said you haven't tried indigestion remedies. That's something you could try. Okay, here we have some examples that we can use. I'm curious about that. I don't know if you have prescribing or maybe advising or suggesting your patients, maybe with some things that that aren't drugs. Maybe some advices. Did you?
Yes, for tummy aches, we can tell them to drink manzanilla and those things, or mate de coca, that things.
Okay. Thank you, Belen. What about you, Lily or Vania, Ale? Maybe something that doesn't include drugs sometimes.
Yes, in case the contusion or hit in
Yeah,
a place
condition.
organism, uh, just cold topic or ice in the place.
That's a good advice. Okay, what about you, Lily or Ale?
Many times the patient referred date are taking other drugs. For example, there are a plant which named its insulin. Then the patients referred was taking this drug, but it is not the drug appropriate with pathology. They are confused.
Okay, so you tell me that patients took some or eat some plants for that pathology, but that isn't work?
I don't understand the question, teacher. Repeat,
Okay,
please.
okay. I was making a resume. I understand that you tell me that the patients were eating or taking some infusion of plants maybe thinking that they are helpful for diabetes, or am I wrong?
Okay, this is correct, teacher. Um, but the insulin, it's a drug, but they confuse with a plant which name it's insulin, but it's
Oh,
not a drug insulin.
okay.
There are a plant with this name.
Okay, I got it now. I didn't know there was a plant. Oh my God, such a confusion, right? Okay, thank you so much, ladies, for your examples. Ale, can you read this part, please?
Yes, miss. Advising patients to avoid something. When advising patients to avoid something, doctors may say, there are a few things about your lifestyle we could address. Perhaps cut down on the amount you are drinking. Giving up smoking would help. Cut out fatty foods. You should try to avoid thick clothing, sitting in deep armchairs and bending, especially after meals.
Okay, Ale, thank you. And what are the suggestions you make, you usually make the consultation? Maybe, I don't know, don't drink so much coffee, maybe for high blood pressure, right? Or something like that. That those are the most common. Maybe Vania?
Yes, eating less salt is a common too.
Yeah, that's good. Ale, what about you?
I could advise the patients about don't drink coffee or don't drink orange juice or milk or maybe spicy foods when they have a gastritis.
Okay, that's good. Lily, what about you?
For example, when the patient is um, hypertense, I advise avoid the salt.
Okay. And Belén?
Well, here in Bolivia, telling them to cut out fatty foods is not going to work because you have to be very specific on what you're saying, because you're going to say, oh, cut out the fatty foods, but they're going to start eating like noodles or rice or that things that also contains a lot of carbohydrates. I don't know how to say
Carbohydrates.
carbohydrates. So we have to be very specific on what fatty foods we have to cut.
Okay, thank you so much. That's true. Okay, Belén, can you read this part, please?
Okay. Warnings. When a doctor wants to warn a patient that consequence of ignoring the advice should be serious, he or she may say, if you aren't feeling better in the 7 to 14 days, you really must come back and see me again. If you need damaging it, you're going to end up with a long-term problem. If you feel that things aren't settling, aren't getting back to normal, it's important that you see me again.
Okay. As you can see, Those are not only advices, are warnings. Or maybe we can treat our patients, right? They can be most of the time feel scared about the things that doctors say, but it's important to tell them the consequences if they do not take the prescription as clear as they tell you or tell them, right? I don't know if you have questions here for vocabulary.
No, Miss.
Okay.
It's fine, Miss.
You miss.
No, teacher.
Perfect. And the bad part, right? Giving bad news. Principles of giving bad news. 1, give warning. I'm afraid your test results aren't very good. I'm sorry to have to tell you that NIWA isn't good. Okay, number 2, choose an appropriate setting and have a friend or relative of the patient present. Take time, number 3. Number 4, use appropriate language. 5, emphasize the positive. For example, there's still a lot we can do to help you. Chemotherapy will make you more comfortable. Number 6, discuss the prognosis. One can never be certain about these things, but I'd say it's a matter of months rather than years. Okay, this part is more for a maybe terminal patient, right? I hope you can never have the experience, but we we cannot be certain of that. Um, I don't know if you can add something here. Maybe some kind or some way you act or something you say to tell this kind of news, or you are agree with this kind of protocol.
I agree, Miss.
Okay.
I agree, teacher.
Okay, Lily
I'm agree too, Miss.
and Vania.
Yes, me too. And Miss, what's the meaning of rather? I don't remember.
Rather, I'd say it's a matter of months rather than years. Es una cuestión de tiempo más que de años, o de meses más que de años. That's the meaning, más que, for making a comparison. Did you get it, Vania?
Yes, yes, yes.
Okay. Okay, so number 7, supplement the verbal message. I like to record this consultation so you can listen again if anything isn't clear. That's a good way to give the instructions to the patient, right? Maybe some patient is older and he maybe wouldn't be able to go with his family, so this will help him. Okay, number 8, arrange a follow-up session. I'd like to see you again next week. Can you come in again next week? Just to control the evolution, right? Number 9, confirm that the patient understands. So you can say, could you tell me what we are going to do for you? Is everything clear to you? Another way to say this or to confirm this is, can you repeat what I just say, right? in order to know or to realize your patient understood. Okay, here we have just an example, but I don't know if you have, well, we don't have enough time to discuss this, but I hope it can be clear. Do you have any questions still here? Or is perfectly clear?
It's clear, teacher.
Okay. What about you guys?
It's fine, Miss.
It's clear, Miss.
Okay. Vanya, are you okay?
Yes, Miss, it's clear.
Okay, I'm sorry, I cannot hear you. Okay, I will share with you my questionnaire. I will ask you please to fill it for me. And of course, I want to know if you have a schedule to get into the next class. Maybe who's gonna be the first?
Miss, I want to be the last one, please.
Okay, Belen.
First, Miss.
Teacher, I want to be the second.
Okay.
I'll be the third, Miss.
Okay, Ale. Vanya is gonna be the first. Okay, see you next class then. Take care. Have a good weekend. Bye, girls.
Yes.